Ra'o Sina Afakalapu.
This is Sina Afakalapu.
Te mai Samoa.
She's from Samoa.
Mori atu whawhai si o matou malo I Samoa.
Thank you so much to our Samoa government.
Whawhai fo'i ia Apollo.
Thank you so much to our Apollo team
Latou anga lelei ia matou o matou mau ai le malosi.
for everything that you guys done for us.
Tai atu fo'i ia Prasad malanga team.
Thank you so much to Dr. Prasad and the team.
Tai atu fo'i ia international.
Thank you to the international team
Latou lango I latou susuani I matou mai le amatanga se pa ia mai nei taimi.
for always support and being there with us till now.
Thank you so much. Everything you've done for us, Ben. We love you, Apollo. We love you, Prasad, and your team. God bless.
Mrs. Sina, a 46-year-old lady from Samoa, came to us with a diagnosis of Adamantinoma of the left hemimandible, involving both the vertical and horizontal ramus crossing the midline. We resected the entire tumor with a good margins all around, obtained tumor clearance, and the bone was reconstructed using microsurgical techniques, using a free fibula flap which was osteotomized in 2 places, and mucosal replacement was done using skin from the leg. She healed nicely and her occlusion is normal, and she is completely restored to the normal appearance, and functionally she is absolutely fine. Her dental restoration will be done 6 months later. She is fine and she is ready to go home on the 19th of this month.